Why is antibiotic resistance a problem in CF infection surveillance? Imagine fighting a battle where the enemy keeps changing its armor and tactics. That's what happens in cystic fibrosis infections. Patients with cystic fibrosis often have thick mucus in their lungs that traps bacteria. These bacteria, like Pseudomonas aeruginosa and Staphylococcus aureus, can become resistant to antibiotics over time. When doctors use antibiotics repeatedly to control these infections, the bacteria adapt and develop resistance. This makes infections harder to treat and can lead to more severe lung damage. Because cystic fibrosis patients need long-term treatment, their bacteria are exposed to antibiotics many times. This ongoing exposure encourages bacteria to develop mechanisms that protect them from antibiotics. They can form biofilms, which are slimy layers that shield bacteria from medication. These biofilms make it difficult for antibiotics to reach and kill the bacteria effectively. Some bacteria also develop multi-drug resistance, meaning they can survive many different antibiotics, not just one or two. Traditional tests that check how bacteria respond to antibiotics, called susceptibility tests, have limitations. They are usually done in labs using simplified conditions that don't fully mimic the complex environment inside the lungs. This can lead to differences between what the lab shows and what actually happens in the patient's lungs. As a result, doctors might think an antibiotic will work when it might not, or vice versa. This makes choosing the right treatment more challenging. The lung environment in cystic fibrosis also affects how well antibiotics can reach the bacteria. The thick mucus and altered lung tissue can prevent antibiotics from penetrating deeply, which means higher doses might be needed. But increasing doses can also increase side effects, so doctors have to find a careful balance. When bacteria become resistant, they also tend to reduce the diversity of microbes in the lungs, which can lead to more aggressive disease progression. Developing new antibiotics takes a lot of time and effort, so managing resistance relies heavily on careful infection monitoring. Advanced molecular diagnostic tools can detect resistance mechanisms more accurately than traditional tests. These tools help doctors personalize antibiotic treatments, avoid unnecessary use of antibiotics, and slow down the development of resistance. In infection surveillance, healthcare teams work together to monitor bacterial behavior and resistance patterns. They interpret lab results alongside clinical responses to decide the best treatment plan. This coordinated approach helps prevent overuse of antibiotics and preserves their effectiveness for as long as possible. In summary, antibiotic resistance complicates infection surveillance in cystic fibrosis because it makes infections harder to detect and treat. Using advanced diagnostics and practicing careful antibiotic stewardship are essential to managing these infections effectively. This ongoing effort helps improve long-term health outcomes for people living with cystic fibrosis and keeps their lungs healthier for longer. Always remember, individual treatment varies, so it's important to work closely with healthcare professionals to find the best approach.